Welcome to Neuroseduction, put science back into neuroscience, with me, your host, Lily Fimopoli. Today we have with us Dr. Radhika Jaladi. Dr. Jaladi is an internal medicine specialist at SSM Health Rehabilitation Hospital in Bridgeton, Missouri. She is certified by the American Board of Internal Medicine. So, Dr. Jaladi, since you've traveled along an arduous path of becoming an internal medicine specialist, what inspired you to go into medicine, and specifically internal medicine?
Lalit, thank you for having me on. It's nice to talk to people that are just starting their careers. Um, what inspired me would go back, I guess, several years, probably much younger than where you are now. Um, I actually grew up in India, and back then, during your summers, you probably go visit some of your uncles and aunts. One of my aunts was a doctor. She was internal medicine, and in India, internal medicine back then was managing everything, like a few deliveries, basic surgeries such as appendectomies. Um, so when I spend some days during my holidays, you can call it like a shadowing. It wasn't for that purpose, though, it was just for fun.
Yeah.
However, during the nighttime, when a woman that's pregnant would knock on her door, I instantaneously would wake up and I would be the person opening the door. It was quite an experience because even though my aunt wouldn't allow me into the operating room, I was able to peek through the window. And I did not understand the surgery itself, but I saw the outcome of a baby. And I really loved what transpired in that room. That room almost felt like somebody giving new life. And so that was my first experience of what a doctor was. And along those same lines, there was another incident where um, I had a really bad stuffed up nose that I couldn't sleep all night and just couldn't breathe and was in quite some distress. And they took me to the doctor, and the doctor was not available. And so I didn't realize, but apparently it was the doctor's secretary. Um, and I thought it was the doctor.
Yeah.
But they gave me the medicine, I guess, from their experience. It was actually neem leaves, and they gave me an inhalation that kind of instantaneously relieved my stuffy nose and the breathing problem. And I slept through the night, and I just liked how I felt and how she made me feel. And I really wanted to make others feel like that, like you would have some magic that would make people feel better.
Yeah.
And I really wanted to do that to others. And so it's been a very neat journey, and that inspired me to go into medicine and internal medicine.
I mean, that's a very in-depth story. And because of that, you became a doctor. So becoming a doctor requires many years of schooling and dedication to keep continuing. What would you say is the process to become a doctor?
Um, so I think the process to becoming a doctor is pretty much similar to several other careers. You would still do disciplined learning, attend the college, take your tests, the grades. Um, but I think what's beauty of medicine is alongside your learning, book learning, you would do some practicums, which is like patient care that you would observe,
Yeah.
which I think shows you the a connection between what you're learning versus what you're applying to people. And so that learning process is immense. You can connect things directly, and you see the benefit in people right away. So it is. It's pretty much same to other careers, except that it's more of a uh, people care. So you would have a lot more hands on for a long time.
Yeah. So as you are an internal medicine specialist at a rehab hospital, what type of cases do you primarily see?
So at this time, since I work at, at an acute rehabilitation hospital, which involves more physical rehabilitation, particularly for patients that have had acute strokes, meaning they are paralyzed or they cannot move one half of the body, or they could have had spinal cord injuries. That means they're paralyzed or cannot move the lower half of the body or all four of their extremities. Quite devastating situations, but I think situations where good medical monitoring care along with intense physical therapy can get them their strength back. We also get traumatic brain injuries like motor vehicle accidents, head injuries, where people are extremely confused. Again, another situation where if you provide good physical therapy, they can actually become normal. So those are the three main kind of situations that we see at this time.
And what is your role in all these cases?
So as a I am actually the medical consultant, and I work in collaboration with the physical medicine rehabilitation physicians. Um, so, so if in a person with stroke, they would have underlying high blood pressure, diabetes, a heart condition, which kind of needs to be monitored until they're getting their exercises and to make sure they don't have complications or decline and continue to improve. So these patients would come like about third day after their hospitalization. So they're still kind of in a delicate state of medical health that needs to be monitored and treated. And similarly goes for the traumatic brain injuries and the spinal cord injuries.
So, since you have a long history in internal medicine, what would you say some of your most fulfilling cases are?
I think I should say that every physician at some point in their lifetime probably has heard people tell them that you've saved my life. Thank you. And I think that's the most fulfilling statement ever to hear, to cherish and memorize. Um, and I've had a few situations like that where people have thanked me, families have thanked me, and made me humble on what I could do. So, particularly speaking, there was a woman that was in her mid 40s that came to the hospital with severe back pain, like upper back pain.
Yeah.
Typically, they get admitted from the ER. The ER kind of tried to do x rays, some basic workup. They could not find a cause, but then her pain wasn't better and she was just in distress. So they admitted her. So I still continued to work up her back, which like MRI of the spine, having a back surgeon's consultation, etc. And nothing really panned out. And I gave her a ton of pain medicine, and the pain wasn't subsiding. Interestingly, the only other thing that was going on was her heart rate was pretty high. And sometimes in blood clots of the lung, you can have a high heart rate. So it was kind of uh,
Yeah.
an epiphany. Oh, shit, maybe something else is going on here. So I checked her for a blood clot, and indeed she had a blood clot, and the blood clot actually blocked her blood flow to a part of her lung, and she had what we call infarction of the lung, which was causing her pain. It is a weird presentation of a blood clot. And we got her on treatment right away. She got better, and in about 3 days, she went home. But I think she was a patient that knew how devastating a blood clot in the lung can be. So she really held my hands the next day and said, "Thank you so much for saving my life." And I think that was the first patient that really said that to me. And it was both intellectually satisfying as well because there was a diagnosis none of the other doctors were able to pick up on. And that, that I thought I noticed something that was out of ordinary. And there was another patient that came with chest pain, and typically with chest pains, we would make sure the first thing we make sure is not a heart attack. And how we do that is by an EKG and 3 blood tests over about an 18 to 24-hour period. And this person got their blood test and everything was negative, and they were actually getting ready to discharge her. And like how they get handed over. So she told me the pain isn't gone, and she was like, "Believe me, doctor, something is wrong. This is not ordinary. I don't feel like this." And so I said, "That's fine. Let's not discharge her and repeat the heart test all over again." Interestingly, the fourth blood test was positive for a heart attack, which by the book, you're supposed to only do three. And if three are negative, you're fine. Um,
Yeah.
so I think um, we got her to the cath lab. She got a stent, and it was an amazing story. What I think what that also teaches is sometimes people don't follow the book, and not everything is per the protocol. And we want to listen to the patient. When we listen to the patient, actually, they will tell you sometimes what to do. So that was, some people may thank you, may not. Some people may recognize what you did not. But overall, definitely, that during your journey, you will save lives. And there's actually one another person that I do want to say it's not a medical condition, but so this person was an executive in a company, and he was losing weight and suddenly did not feel well and came into the hospital.
Yeah.
Um, there's only one thing that was abnormal, and that was his blood sugar was high. It was in the 300s. But we did a bunch of tests, made sure got nothing else. And I walked into his room in the morning, and I told him that he had diabetes, that the sugars were 300, but if he takes his pill, he says, and his sugars will get under control, then he's as good as a normal person and he can go home. And then he told me the minute he saw me walking in with a smile that he knew he wasn't dying. And that was all he had to feel that day or forever. In fact, he wrote a letter to the hospital administration saying that more doctors need to smile. So I think that smile reassured him that he
Yeah.
wasn't having any life threatening illness. So a lot of times it may not even be a big diagnosis you make, it may just be a reassurance that they're going to do fine. Um, and that's mutually very fulfilling.
Wow. I mean, those were some amazing stories. And if I took one piece of advice from that, it'd be smile whenever I do something. So, but let's switch to a different topic that's more affecting society now, such as the pandemic. So, COVID has affected many different people and has influenced the field of medicine. How have you had to change due to the pandemic?
Um, so I think the biggest thing with COVID was, we're living in evidence-based medicine. We're used to like, oh, here is the evidence for this medicine, here is the evidence for this condition. Now here is a disease where we have zero evidence. I mean,
Yeah.
at the most, we can treat based on saying, okay, what did other coronaviruses do? And maybe this one is more virulent than the others. But we have no evidence to tell people or to convince anything. So we have to go by past experience alone. And it was hard for people to take. I mean, as a physician, we still feel responsible. We will still treat them the best of our ability and our knowledge. But for people to be advised to one medicine, then the second day say, oh, no, 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 now we don't think this is the right medicine, or oh, wear a mask now, or don't wear a mask now. It's hard to explain that, now we have new evidence, or now we've come across this. And so that quick change and evolution was something was hard to explain to people,
Yeah.
um, and for people to understand too. So, but I think new diseases can happen, and we need to embrace that. Also, the other thing was getting people on board, right? Sometimes you tell people, here is the treatment, and some people may not do it. And you treat it as, okay, this is their health. You've done your best explaining them, and it's their decision. However, here is a condition now where what they do may not only influence them, but people around them. So, in terms of going to the hospital, you're sick, or maintaining your social distancing, or wearing a mask, or taking a vaccine, and even though it's hard, I think keeping the conversation transparent, talking does help, but it involves effort and time. So um, what I've learned more is to
Yeah.
talk more, explain more genuinely to understand the other side, and people then can buy into what you're trying to say. Also, I think what COVID has taught us is that we need to respect and embrace the nature we are in and feel like we are part of the nature. So, as I think it must have been Bill Gates who said the biggest threat to mankind is not wars, but microbes, which is very much true. Look at what this pandemic is doing. So, the more resistant these little bacteria become, I mean, think of AIDS, you can't even see the bug. Even COVID 19, you can't even see the bug. Think of the devastation it's doing.
Yeah.
So, some things in nature, the other living beings, we need to respect and build our immunity and learn to live symbiotically with nature. So, overuse of antibiotics is an example. We use more antibiotics, then the bugs become very resistant, and then we are stuck with resistant bugs that can be more deadly. So, being judicious in how we treat other living beings, um, and learning to live with in harmony is another thing that I have learned during the COVID pandemic.
So on the same idea, COVID has taught us so much while you just described. So because of that, what ways do you think the field of medicine should change in the next 10 years?
Um, so I think even with COVID or any other illnesses, medicine is extremely good at treating deadly diseases and at treating acute diseases like heart attack, like cancer, things you know are going to be deadly right away, things you know need to be addressed right away. But as far as chronic diseases go, I don't think we've done a judicious job, particularly in terms of lifestyle changes like diet, sleep, um, and stress relief, things that probably play a big role in chronic illnesses. But in medicine, we kind of neglect them. We still focus on just medicine alone. And I think there should be more funding and more research for those things, because I think diet, sleep, and stress relief will play such a big role in immunity and healing, um, that can avoid so many chronic illnesses, both prevent and treat chronic illnesses. So I think we focus heavily on pharmaceuticals, but I think an equal amount of focus needs to go on lifestyle changes. Um, Secondly, I think a lot of times there's a lot of administrative influence, which I would love to see minimize through the next 10 years, and become more patient focused. When I say administrative influence in a hospital, particularly, like length of stay, cost of patient, I think things that a physician should be free of and be more patient focused.
So finally, one last question, which is there are many students who are interested in going to medicine. So what is some advice you can give to them?
Absolutely, go for it. I think everybody should and can. Um, it's a very beautiful field in so many dimensions. Um, Very intellectually challenging and fulfilling too, um, and well respected in the society, um, well paid, um, and definitely above all very fulfilling to the heart. Um, so the benefits are immense, and I shouldn't even say the word benefits. And I think what happens is there's several myths that run around medicine. I don't think students should be swayed by those. Particularly, you have to study more hard or academically it's more challenging. I don't think so. I think if you are able to get through high school with decent grades, you can get through medical school very easily. You have to remember that it's the same journey, just a bit longer. Although, when I say a bit longer, another myth is also that medical school is a long journey, and I don't think so. So, think about it. If you have your 4 years undergraduate and you have 4 years medical school and residency should not actually be considered as a learning, as a schooling, because there is not necessarily books, not grades, no testing. In fact, you'll be paid. So that should be considered as work. So really, it's only 8 years. And then, so if you were to do any other career, like you would do master's, it's just 2 years more than that. So you'll just be studying just 2 years more. And as long as your mindset is ready for that, and it's not too long, honestly, that it's so that's the second myth. I think people get boggled, and it's not true. The third myth um, sometimes is that it's stressful. And yes, there is, it's a very dynamic process treating people that come into you in a vulnerable state. They themselves are stressed out, first of all. They don't know what's going on with their health. And they're seeking help, really. And for you to be able to diagnose and then treat, um, but with a little bit of proper experience, you get through that stress. There are other stresses too, but I technically feel stress is there in several jobs. Any job that would entail a responsibility would come with a stress. But it's not there forever. There'll be moments of up and down. But with that also comes with big results. With that responsibility comes with big results, like saving lives. So it's worth it.
I mean, thank you, Dr. Jaladi, for giving me some time to listen to you today. There's so much you told me, and I will make sure to use it every time I think about healthcare and going into the field of medicine.
Absolutely, Lalit. Good luck to you, and good luck to all the students out there wanting to become doctors.